Hello, good day everyone. Welcome to my YouTube channel. In this channel, we'll be talking about common medical conditions. My name is Dr. Ahmed Abdurrahman, a practicing medical doctor at the Tamale Teaching Hospital. So in this channel, what we are going to be doing is you take the common medical condition, its presentation, we talk about the possible ways to manage it. So these videos will be relevant to both the public and learners. And when I say learners, I'm talking about medical students and people who want to further their education. So some of the common conditions that we'll be handling here include diabetes, we're talking about hypertension, we're talking about some of the other common clinical presentation of some worrying diseases such as chronic lower back pain. You realize about 80% of adults who face chronic back pain at some point in time in their life. If you haven't had one, lucky you. But trust me, this video will be beneficial to you one day when you experience such a thing. So this is an introductory video and I won't be talking much in it. However, I'll leave you with a small education about lower back pain. Now, when we say lower back pain, it's usually pain that we experience at the back, the lower third of the back. Sometimes the pain may radiate down to the legs or the thighs and even sometimes the buttocks. And you may have a lot of discomfort, especially performing certain movements, which in medical terms we call discogenic movements. Now, when you perform a discogenic movement, it exacerbates the lower back pain and you will not find it easy at all. A lot of adults suffer from this condition. However, they don't know the best way to handle it. Some even resort to a non-medical management, which is not the best, by the way. So the lower back pain has different causes. There are multiple causes of chronic lower back pain. I'm going to put them in simple categories for your understanding. We can have a mechanical lower back pain, we can have neurogenic lower back pain, and we can have non-mechanical lower back pain. When we talk of mechanical lower back pain, what does that mean? Mechanical lower back pain usually are pains that come from injuries to the lower back. That is, there is a mechanical trauma, and its manifestation usually differs slightly from the neurogenic lower back pain. So you realize that mechanical lower back pain, they are usually pains that are exacerbated when you perform a certain movement, and they rarely radiate to the buttocks or thighs, or sometimes down to the legs. It rarely radiates to that part. They don't usually have associated numbness or paresthesia in the legs. These are some of the features that will help you distinguish between a mechanical back pain and a non-mechanical back pain. The other category, we have neurogenic back pain. And neurogenic back pain, they are usually as a result of disc herniation or spinal cord compression or compression of the foramina. When the foraminas are narrow, there's compression of the nerve roots passing through them. And this leads to neurogenic pain. Okay, so you realize that for the neurogenic pains, they are usually associated with numbness in the legs. They usually have paresthesia. There will be weakness in the legs. And it can be so bad to the extent that some people will become paralyzed. They can't even walk. Okay, so the neurogenic back pain, it's usually typically to start gradually. Unlike the mechanical one, where you will suddenly have the pain, the neurogenic course will start gradually, to start over years sometimes, okay, and progressively get worse and start radiating to the back of your thigh or your buttocks and rarely to the calves. And you realize that you are walking distance begins to reduce, in which case we call it neurogenic claudication. You realize that there is some point when you walk a small distance, you have to stop to rest before you continue because of the pain at the back of your thighs or the waist pain. Okay, this is called neurogenic claudication, and the distance that you walk is called neurogenic claudication distance. Okay, and usually it will be associated with numbness in the legs. So progressively, you will develop numbness in your legs, and also you will start feeling weakness in your legs. You stand it for some short time and you realize that your legs are already shaking. This is a neurogenic cause. Okay, now enough about this. I'm also going to talk about the non-mechanical causes. The non-mechanical causes, usually we talk about neoplasms, that is malignancies. Unfortunately, this is usually the cause that we are not able to modify well. For the malignancies, there is very little you can do about it. However, when it is detected early enough, you can get a cure or a near cure treatment. Okay. Another non-mechanical cause is an inflammatory condition, such as arthritis. You can also have arthritis that will cause this pain, and you will not be able to accommodate it. Okay. Sometimes it's very frustrating, especially in our elderly people. Okay. It's when they start having this degenerative this disease, it begins to creep in gradually and they start having this lower back pains and they complain a lot. So after speaking about it and how it manifests, let's go briefly to how you can manage it. Now, when you have it, uh, not all the cases require surgical treatment. Okay, just to clear the notion most people have that when you have such a pain, it can only be treated surgically. Okay, I'm going to give you an order in which you can manage the pain. Okay, so I'm going to talk about the treatments. This is the order in which you usually have to attend to the lower back pain. As a medical professional, we usually consider certain investigations. Okay, you after taking the history and doing our physical examination, we do certain investigations. Okay, we do the preliminary tests or the basic labs. Okay, the complete blood count, and then we do certain imaging. You start with an X-ray. If the pathology is found and we notice that it can be managed medically, we don't need to investigate further. We start management from there. And if it's not found, we may go ahead and do certain investigation we call computer tomography scan. That is the CT scan. Okay. If this does not reveal enough, you have to go ahead and do magnetic resonance imaging, which we call MRI. It's a more advanced imaging technique usually we use to investigate. Okay. After all these investigations, we come out with the course. Now we have to let you go through these steps. You start with medical treatment. We give you medications. Okay, we give you medications for you to take. If you want to know some of the medications that we give, you can contact me privately via my email in the link below. We give certain medications to help with the pain and then to help with, especially if the cause is arthritis, to help reduce the inflammation. So you notice we are giving some anti-inflammatory agents to manage the pain. The next step from the medical treatment is physiotherapy. Okay, so you do physiotherapy for say 1 month. If we notice that with the physiotherapy you are getting better, we stick to it. Okay, now if assuming you do the physiotherapy, you are still not getting better, what else do you do? We go ahead and do the next step, which we call injection. What type of injection is it? Usually we give an epidural injection for the lower back pain. An epidural injection usually consists of a certain anti-inflammatory agent and analgesia, which we inject at the lower back to relieve the pain, okay, and then to calm down the inflammatory flare up that is causing the pain. Okay. Now after the injection, if you are still not getting relief, then we resort to the last option. Okay, then you have to undergo a surgery, so that if for instance, say there is spinal cord compression and it is severe, then we have to go and decompress. So we perform what we call decompression surgery, and the decompression surgery can happen at different levels of the spine, okay, depending on the site that has been compressed. Okay, so this is what we do for it. Now, mostly this management, realize, is built on certain blocks. When it is a mechanical cause, now the best thing is to avoid the particular mechanical agent causing the pain. Okay, says you are performing a certain work that involves rapidly lifting heavy objects, bending and lifting heavy objects. It falls under the category of movements I call the discogenic movements. When you are performing such activities, such cause is mechanical, so you have to stop such a work, okay, in order to prevent your condition from deteriorating. So this is the first video, and it's an introductory video. I hope you benefited from the little I have given you. Please do subscribe and like, share my videos. Okay, hope to see you in the next video, when we will be talking about hypertension. What is hypertension? Is it different from high blood pressure? Is anyone having high blood pressure also hypertensive? Are they the same thing? Are there any differences? This is mostly